Hey, welcome to another episode of Ask Dr. Darwin. We are live, well, we're recording it live, but here at Howard University with a D3 student. You want to introduce yourself?
Hi guys, my name is Minh. I'm a third year student at Howard University College of Dentistry. Just here today to touch base with Dr. Hayes. He's doing some great things online, giving us really a free material just to help everybody out and cast his knowledge and shows it to as many people as possible that is receptive and wants this information. It's extremely helpful, and I really appreciate his time to come down here today.
So we kind of met via online, right?
On YouTube, yeah.
On YouTube.
I just sent an email.
Mm-hmm. But how'd you find out about my YouTube page? Was it
trying to prepare for the pass?
Pass.
So what do residencies look for? What do particularly orthodontic programs, what do they look for? How do I get in? What's match like? And some of the key words were popping up in Dr. Hayes' channel.
Oh, okay. So you were doing your own search.
My own search to get ready.
And some of the videos that I had done had kind of come up on that search.
Yeah. Or I was curious about what you were saying, how for pre-docs to get pre-dental to become pre-doc students. I was just curious of some things that, it's been a few years since I applied, but what you're sharing with them is like, okay, some things were applicable to me and stuff like that. So that's what kind of triggered on what else you had on your channel.
Okay. So tell us a little bit about you. What are you, where you're from? We know you're in the third year of dental school. What your plans are? Just a little brief synopsis on that.
I plan on applying to orthodontic residencies. A lot of programs because it's very, very competitive, but I'm from Sterling, Virginia. Mm-hmm. I kind of had a feeling many, many years ago that I would actually go to Howard University Dental School, being that DC's home. Very happy to be here. But with being an only child, you kind of learn make a lot of mistakes on your own, and you kind of pay for it in different ways, but it's kind of helpful in other ways too. So the only way to get ahead is to reach out to as many people as possible to not make those mistakes and maybe learn from other people to help guide you in the right directions.
Right. Yeah. Okay. Well, cool. Well, let's figure out how we can guide you and get you in the right direction. We know you're applying to ortho programs or getting ready to apply. How long has this been a process for you? As far as how long have you known that ortho was the chosen path?
I've known that it was the chosen path for the January, March, April, 3 months now.
3 months.
3 months that I said, this is it. There's nothing else out there for me. It's ortho or nothing.
Okay.
But it wasn't an overnight thing. It was a 3-year process.
That led up to this decision. It's a process. He said it's a process, 3-year process. Not something overnight, even though it's been 3 months that it's been really solidified. But it was a 3-month process.
Mm-hmm. Yeah.
Wow.
Yeah. 3-year process that's now been solidified for 3 months and forever. This is it.
Okay.
I am set.
Okay. So cool. So what are your questions? Let's figure out how we can.
The first question, because quite frankly, I'm not the top in the class. So unless you're top of the class with oral surgery and orthodontics, that the stigma is you have no chance of getting in. You have to be one or that's it. So, but there are many candidates that do match, that aren't number one, that maybe have non-traditional applications and non-traditional dental students like myself. So my first question is, and this is related to having to do a GPR program versus orthodontic programs, the time of applying for maybe both and how to navigate, and some of the questions I have are related to that.
Okay.
So the first question is, what aspects of GPR residencies that orthodontic programs look for to make a candidate more competitive?
Great question. So what do ortho programs look at from GPR programs and make them good candidates? First and foremost is you got to be a great general dentist, right?
That's right.
Remember, ortho is a specialty of dentistry.
Right.
It deals with what it deals with. But what happens also as an orthodontist, you're a better orthodontist based on how you are able to apply general ortho to general dentistry solutions and how to solve those problems, right? So for many general dentists, the problems that we refer you to are based on skeletal malocclusions, maybe some spaces, some impactions, all of which are affecting the dentition. In some cases, with some facial orthopedics, it may be affecting someone's speech or something like that. But for 9 times out of 10, a lot of the general dentists are sending stuff to orthodontists for things either we don't want to deal with, or there's some skeletal issues that we just can't fix.
Okay.
But knowing about that as a general dentist, from a perspective, from the general dentist perspective, is very valuable, because now you and I can talk about my treatment plan and why I'm referring the patient to you as relates to what else I need to do for the treatment plan.
Okay.
So ortho may not be the only referral that we have. I may have an implant referral. It may be some endo combined with that, especially if we're doing full mouth rehabs. Maybe there's a couple of teeth we want to move in a different position versus extracting them and having a place of bone graft and things like that. Or there may be a couple of teeth we want to upright. So as an orthodontist, you need to be able to be in the mix of all of that. Well, the best way to do that is as a general dentist.
Do it.
Yeah, to do it.
Right. Okay.
So I think ortho programs really appreciate having that general dentistry background as relates to comprehensive care.
Okay.
Because we as general dentists are typically the quarterback, so to speak, of that comprehensive care. So as an orthodontist, being able to relate to a GP's perspective, treatment plan, and understand what they're trying to achieve, it's going to help you as an orthodontist being complementary to that treatment plan.
Okay.
But you only get that experience by being a comprehensive dentist.
Right.
At least that's my viewpoint.
Okay.
So I think that's helpful. Now, not all programs are gonna actually want that. Again, it all depends on the mission, the purpose of the program.
Right.
Some orthodontic programs are more geared towards getting you board certified or getting you to become faculty and teach. So just kind of really depends.
Okay.
So I think that's my answer to that.
Okay. Second question. I see that Bronx Lebanon has an orthodontic program. If I do a GPR at Bronx Lebanon, does FaceTime with the Orthodontic Residency really make a difference to get into that particular program?
That's a good question. I can't answer that question only because
thanks for that.
I'm not involved in the ortho process, selection process.
Okay.
But what I will tell you that we have a trend, and it just could be unique to Bronx Leb, that our current residents that we have in the first, second, and third year program, of the 3, 2, 2, that's 7. Of the 7 that we have, 6 of them are former GPR residents from Bronx Lebanon, from over 20 years ago to as soon as last year.
Okay.
So, does the FaceTime help? Well, it could be argued that maybe it does help in that particular case. But I think wherever you go, it's going to help because at the end of the day, as a candidate, no one knows about you.
Yes.
Right?
Right.
No one knows about you. And one of the reasons why you want to do an interview is because the program wants to learn about you, but you want to learn about them.
Right.
So that's where you have the FaceTime, so to speak. Right? So having more of that, I think, helps at the end of the day. But I think that's a question that's more geared towards the program directors because each program is different. They may not want former residents from our GPR AGD program. They may want totally new residents with a totally different perspective, totally different types of training. It just depends. So that's why it's so very important when you're looking at programs, I think, that you have to be able to ask the tough questions and find out it's not what they're telling you, it's what they're not telling you. It's about typically, look at a track record maybe of the last 5 or 6 residency classes and see where they're coming from. Mm-hmm. Maybe there's a trend. Maybe there's not a trend. Where did the program director train? Where did she or he train from? That may have there may be a connection there. But all those are things that you can maybe try to figure out, because it may be for that program that building that type of relationship over the point of having a GPR, doing a GPR there, and then transitioning into an ortho program may be helpful.
Okay.
Also, you got to keep in mind. I mean, that may be one factor, though.
Yeah.
Because you still have the other factors as far as class rank, your essay, letters of recommendation, all those types of things.
Mm-hmm. Okay. Last question. If I apply for GPR residencies at the same time as orthodontic residencies, I don't know if that's possible, at my interviews for GPRs, should I tell the interview committee the truth that I'm doing their GPR, or a GPR so I can do orthodontics? Or any other specialty? Now, this would really relate to any specialty then.
Yeah, that relates to any specialty. It really depends on the preference. Well, I would tell you, you'll probably get, if you ask 10 different program directors, you're probably going to get 10 different answers.
What would be your answer?
So for me as a GPR director, I could care less. Actually, I would rather you tell me, because one of my goals, or our goal for your training as a GPR residency, may be to try to get you more exposures to ortho, if possible, or try to help you and encourage you to maybe use some of your continuing educational leave, and tell you, if you're thinking about ortho, you need to go to the ortho meeting. It's in San Diego this year, in June or July or August or April. You need to go. But if I don't know that you're applying for ortho during the time you're doing your GPR year,
you can't help us to
I can't suggest that.
Right.
So I think for me it's helpful, and we have people that are undecided. I mean, after 2 years of clinic and working either in ortho or pedo or endo, I mean, you're not going to necessarily know. You may not know if this one specialty is what you want to do.
Right.
It may take a GPR year where you have some more experience on the GP side or the specialty side to kind of figure out and make the determination, yep, ortho is what I want to do. Now, on the flip side, I don't know what the orthodontist or the orthodontic residency programs would say.
Right.
They may say, well, no, we only want people that are 100% ready for ortho. We don't want people who are, I'm not sure. But it's all about how you present it, too. You may say, hey, well, yeah, I'm applying to both. And one of your reasons could be to yourself is, I'm applying to ortho because I want to get that face time. I want to get out of obscurity maybe a year or two early. Mm-hmm. Also, I want to see what that process is like.
Okay. Right?
And then on the flip side, for the for the GPR side, I think most programs, like we said before, they kind of want people that have some general dentistry, some advanced general dentistry background. Okay. About 4 or 5 of the current 7 residents did GPRs, worked as attendings or chief residents, so they did a second year, worked as attendings. One worked at least 3, another one worked at least 8 years before they applied to ortho and got into the ortho program. So you've got anywhere from 2 to 8 years of experience doing general dentistry. Wow. As an adjunct to their application and wanting to be an orthodontist. So there you go.
Okay.
So I think with PASS now, at the DIA and PASS, the application process, you're able to have 2 different types of essays. You can have a general dentistry essay. You can also have a GPR or AGD essay. You can also have one for ortho. The trick is, and I'm not sure, you have to look, make sure you check and confirm it, but with your letters of recommendation, I think you can only have 3, meaning 3 across the board. If you're applying to GPR or general dentistry, or if you're applying to ortho, you can only have 3 in your application, I think.
Basically, it's limited within paths of how many are in their database to say.
I think so. You have to. I know they've changed it a little bit, so you have to kind of confirm and check. But from what I remember, you can only have a maximum of 3. With that maximum, you may, depending on which, how you go about it. If you're applying to ortho, you may want all 3 of them to mention ortho, or I know what it is. Some schools will do what we call a dean's letter. And in the dean's letter, she or he may say that when they're writing that letter on his behalf, may say something very general because they know that he's applying to GPR and in ortho programs. Whereas if they knew that you were just doing ortho, they're going to tailor it more towards ortho. And it may be the same for also the 3 letters from faculty. If you can't have different ones for different specialties. That's something you have to find out. I can't remember how that goes.
You see how my situation is like with the questions, there's like a lot of factors that go into it. And it changes the application process. How do you navigate that? And trying to position yourself.
You may be able to, it all depends on your personal statement too, or whatever you're going to give to a potential faculty to write on your behalf. You should communicate both in writing but also one-on-one with them. After you've developed a relationship, I think you should let them know that you're looking for a letter that talks about general dentistry and how you may be interested in pursuing ortho, or how your pursuit of ortho is related to your experiences through general dentistry. All depending on how the letters of recommendation can be written.
Right.
You know what I mean?
Yeah.
But I know from talking to a couple of the deans of student affairs that write letters at several schools, there's only one dean letter.
Yeah.
And with that letter, if you're interested in perio and GPR, you've got to let him or her know how to maybe try to structure it. If you're only interested in endo and that's it, then she can structure it that way.
Right.
Versus trying to do separate letters because you only get one dean's letter.
Okay.
So that's why it's important for you to mention that to them on the onset, because you're not going to know what's going to be said.
That's right.
But you want to be able to communicate to them that I have a strong interest in ortho, but I'm thinking I want to do a GPR first. What do you suggest, Dean Smith? Do we suggest that we should do a letter that's more general, or should we focus it more on ortho? And he or she may say, well, let's do, if you're applying to more GPR programs this year, we'll tailor it more general. Right. So, but I would tell you, don't get too far caught up in it because you're going to lose time. You're going to lose time. And for some of these ortho programs, the deadline is very soon. Yeah. Like it starts up in July, like the first, could be July 1st, July 15th. Yeah. So it's really quick. So now that it's April, getting ready to be May, it's that time. They got graduation, other things. They got grading papers or assignments. So now's the time to kind of continue to build those relationships so you can get those letters done. Yeah. Yep. Good. Yeah. Good. That's all the questions you had? See, look at that. We're able to knock those questions out just like that. So that's cool. Yeah. So, one of the things I did want to share with you is, like we talked about today in the seminar to the second and third years, is this whole process, you've got to start early. There's no such thing as never too early to start. Now, I think you said about 3 years ago, kind of like in some part of the process?
3 years ago, I highly considered orthodontics, but was never fully sold. Mm-hmm. But because time was coming up, and I usually like to plan 6 months ahead, so December was coming around, and then that's when I was like, okay, let me vet out orthodontics, whether it's in or it's out. And right. I did that by seeing what the end goal was like, by going to local offices, just letting me ask some questions, visit for the first time. I've never been to a private practice, like at least a large volume private practice for orthodontics before. Right. What does the end goal look like? And that would determine, is it worth the journey there? And for me, it was.
Yeah.
And I said, I have a chance to maybe do this sort of field, and I think I'd be a pretty competitive candidate. I want to vet it out, but it's actually more vetted in.
Yeah.
And I vet out everything else because this is what I want.
Yeah.
And yeah, so then January came around. I said, this is it. I have 6 months to get all my stuff together and get as many resources as possible to get my application straight.
Now, coming out of dental school, applying to ortho, some schools have what we call internships or externships in some of the specialties. Mm-hmm. So if you haven't been selected, or if you're not thinking about it, or if you haven't thought about it, now's the time to try to see how you can be part of that if there is such a program.
Yeah.
Also, another strategy I would recommend is finding out when the American Academy of Orthodontists, AAO, I think it is.
It's in San Diego.
It's in San Diego, yep.
I have exams next week, or else I would just
be able to
over
go.
There.
But
it's in DC next year.
It's in DC next year. Well,
so
that's okay.
Like, I watch your channel, so I'm like, I know my homework.
Yeah.
Hopefully, I don't get to that point where I have to go to kind of network and stuff. Hopefully, I can give you good news in December that, hey, I did match.
Well,
but I'm still going to go anyways.
You still want to follow it, even if you can't go this year. I would still follow it because you want to find out what programs were there at the meeting, because there is an alumni reception. Each of the programs that come back for that meeting, they have alumni. They have the school usually comes back and participates. One of the tips that I put in one of the videos is you need to go to those meetings, but you also need to go with the intention of going to those alumni things and actually meeting.
Get your CV together.
That's right. Get your CV together and drop in to those programs and network with the current residents and the alumni, and try to get some FaceTime with the program director. Yeah, you might be like, oh, isn't that too much? Don't you think they may look down upon it? Man, please, your goal is to get into an ortho program. They have to figure out who you are. And right now, they don't know who he is. So he's got to do by any means necessary, as long as it's legal, to make sure that they know who he is. And I would go with your CV, if you have some business card, and just go. I would go try to meet, if there's 10 alumni programs or what have you there, I would try to go to each of the programs and introduce yourself. And then once you do that, you get their business card, whatever. I would follow up the next day or the next week and let them know it was nice meeting them, nice talking to them. Same thing with the residents, because at some programs, the residents are involved in the interview process, and they might remember them. So, but you don't know until you kind of go through that process. So all of that are things that you're probably not going to be told here at dental school that help you get yourself out of obscurity, so that people know who you are.
Yeah.
So that would be my recommendation. So it's okay that you're not going to be able to go, but you still want to find out which schools were there, and maybe try to go visit sometime this summer. I would try to go visit. It could be as simple as, hey, I'm in Atlanta. I have some family in Atlanta. I was coming to visit and wanted to know if I could stop by and see the program, visit the program, go for a tour. There's a large new program in its first year in Atlanta. They take like 18 residents. It might be more than that. As part of a new residency program in ortho. So, and I think they have kind of like rolling admissions. I don't know if you had that school on your list.
I didn't find. There's only one school in Georgia that I saw on the
there's
site.
two.
Really?
You have the dental school, which is Augusta.
I got that one.
Regents Augusta, whatever it's called now.
Yeah.
And the second one it's called the Georgia School of Orthodontics. It's in Atlanta. See, he didn't even know that. What? Look at that. Yeah, man, they take 18 people, 15 to 18 people. Yeah, you gotta check that out. You gotta apply.
Okay.
Because with that number,
chances are higher.
Possibly are higher. Yeah. I just heard that they changed program directors though. The one that was there for the inaugural first year and was helpful in developing the program, I don't think she or he is not there anymore. But still shouldn't prevent him from going down there and checking it out.
No.
I would go down. I would add it to your list. You have possibility of a higher chances of getting in.
Yeah.
Again, your main goal and purpose is to do what?
Match.
To match. Yeah,
Somewhere.
To match somewhere. But preferably a place where you want to be, and it's an ortho program.
Yeah.
So, that whole process starts now. Hey, guys, so I think we're done, right?
Yeah.
Hey, anytime, man. I'm glad we're able to do it here at school at the same time.
Versus a conference call or something.
Versus a conference call.
Really nicely.
Worked out perfect, man. So, hey, if you guys are in one of the areas where I'm at, or if you want to, at any time, want to set up a call, do a coaching call, or just something very similar to what we did, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. We can line something up for a conference call or something similar. If you have a question about residency, you have a question about pre-dental, anything about pre-dental also. We have a lot of people we've been helping prepare for applying to dental school also. Or if you have some questions, some people, family members, colleagues that have questions about their own teeth, about wanting to get their teeth whitened or implants, any of that. I'm just here to help as many new dentists as possible, but also to help some of the people in the general public about their oral health care. So with that ends today's episode. Signing off from Howard University here in D.C.
Subscribe.
So subscribe. That's right.
Click
Thank
below.
you.
I watch a lot of YouTube.
That's right.
Click down below.
Like
Subscribe.
Doc said, subscribe
Hit
below.
the subscribe button.
And also feel free to share this information with people in your database too. All right. Thanks so much. Have a good day.